Hey guys, it's me, Dr. Ree, and in this video, we're going to be looking at the axial skeleton. Now, the axial skeleton can be divided into three parts: the skull, the vertebral column, and the thoracic cage, or the rib cage. We're going to start by looking at the skull. The skull is composed of two sets of bones, the cranium and the facial bones. Now, the cranium is composed of 8 different bones and can be divided into two groups. The first group is the calvaria. The calvaria, it includes the frontal bone, the parietal bones, there are 2 of those, so I'll put a little 2 in parentheses, and the occipital bone. So these make up the calvaria. So the calvaria is this part right here. So we have the frontal bone, the parietal bones, and the occipital. So it's kind of like that little cap on top. Below that makes up the cranial base. And so the cranial base is made up of the sphenoid, the temporal bones, there's 2 of those, and the ethmoid bone. And those make up the cranial base. Then we have the facial bones. There are 14 of these. Well, technically, so there's 14 new ones, plus the ethmoid does count as a facial bone and part of the cranium. So it's part of what's known as the neurocranium and the visceral cranium, or the cranium and the facial bone. So this is the number I want you to just kind of think of, but make sure you check with lecture if you're going to count the ethmoid in which group. So the facial bones include the mandible, the vomer. The mandible and the vomer are the only 2 that are singles. They're one bone. The mandible is one bone, the vomer is one bone. All of the other ones come in pairs. So we have the maxilla, which there are 2. The inferior nasal concha, there are 2 of those. The zygomatic, 2 of those. The palatine bones, 2 of those. Again, all of these are in pairs except for the mandible and the vomer. And then the last one is the lacrimal, which there are 2 of those. All of the bones of the skull are joined by interlocking fibrous joints called sutures, except for the mandible. So here's where the mandible is, and that's where we have our TMJ. The 4 largest sutures, or major sutures, so let's talk about the major sutures. First one is going to be the sagittal suture, and this is where the parietal bones meet in the middle. The left parietal meets the right parietal. That is the sagittal suture. Sagittal, right, going straight down the middle, right, when we talked about the sagittal plane. And that is exactly where we will find the sagittal suture. So you can't see it right now because I'm just looking at a lateral view, but the sagittal suture would be right here where this parietal bone meets the one on the other side. So sagittal suture. Coronal suture is going to be where the parietal bone meets the frontal bone. So where the parietals, the frontal. And so that suture is right here, the coronal suture. It kind of goes in the frontal plane. So frontal, it goes down the frontal plane where the parietals meet the frontal bone. The third major suture that you need to know is the squamous or the squamous, depending on who you talk to, the squamous or squamous suture. And this is where the parietals meet the temporal bone. The last one is the lambdoid, and that is where the parietals meet the occipital. So those are our major sutures. So really, if you break down the bones of the skull, even though there's a lot of them, if you break them down in kind of categories like this, it makes it way easier to remember them. Now, there are several, if we kind of move down a little bit, this is just looking at an actual live image of a skull broken up. So this is a disarticulated. So this is where the sutures are taken apart. And you can see this right here, where this suture would be, right, is the frontal bone. Number 2 is frontal. This is the parietal bone on 19. And so the suture right here would be the right. This one would be the coronal suture. When we look here, this is where the parietal bone meets the temporal bone. So where the parietal meets the temporal is going to be what? Give you a second. Right, the squamous suture. So that goes right here. Where the parietal meets the occipital bone, right here, that would be the lambdoid suture. Good. It sounds like Dora, right? I'm giving you a little space to answer. So this is just a diagram to just show you what it looks like besides just my little picture. Now, you will have this picture in lab where you will be identifying a lot of the parts. So I wanted to go through some of the parts with you now and just kind of coloring in some of the major areas. So first, let's look at our frontal bone. What we see here in the frontal bone is that we have these little kind of dots right here. Those little dots, or those little foramens, little notches, are known as the supraorbital notch or supraorbital foramen. Some people have foramen, so foramen is an actual hole. Some people just have a notch, which doesn't actually go all the way through the skull. Some of the other things to just know is like this area right here is known as the squamous part of the frontal bone. This is the frontal nasal suture right here. This suture right there, that's called the frontal nasal suture. And we call this area right here, so right in the center, and you can even feel that on you. It's kind of that little, like where there's a little divot, kind of flat area of the nose right here. That is known as the glabella. We call this margin right here, this kind of line where it starts to div in, that would be the supraorbital margin. So this is still the frontal bone when we look right here. So the frontal bone is one of the bones that is part of the eye socket. Let's actually look at the bones of the eye socket because that is a common question, and I have like a little fun way of remembering the bones. So here's that sphenoid. In the pink is the sphenoid. Our frontal was this color. So we have our frontal, our sphenoid. I'm just doing black so you can notice that these are the fissures. So this one right here is the optic canal. And the one right here, superior orbital fissure. There's also an inferior orbital fissure that's kind of like right in here. The next one that I want to look at is our zygomatic. So we'll do that in yellow. Our zygomatic is going to be the outside part, so the lateral aspect of the eye socket. Then if we go more medial, so kind of coming right off of that, we have our maxillary or our maxilla part right here. The maxilla continues below that, so this is the maxilla down here. Then if we start, we have a bunch of little tiny bones in here, okay? So some of them in this view we don't get to see too well, but let's just kind of pretend we can kind of see them. So there's this tiny little one, and I drew it. I'm going to just draw it a little bigger so you can kind of see it right here. I'm going to just draw it a little bigger. I'm going to make it kind of like right there. So we get this very small part from the palatine bone right in the eye socket. Then we have the ethmoid bone. And kind of on the side is the lacrimal bone. So here's the lacrimal. Those are the bones of the eye socket. So my little saying for the bones of the eye socket, Ziggy finds lovin' every man seen. Ziggy. So Ziggy standing for zygomatic. Finds, frontal. Love, lacrimal. Lovin' every, ethmoid. Man, maxilla. Seen, sphenoid. So, Ziggy finds love in every man seen. Now, there are a few other little, on this picture that I have that kind of show some other of the bony markings that you need to know. So like right here underneath the eye, we have the infraorbital foramen. So here was a supraorbital foramen. This is the infraorbital foramen. We have on the side right here, here's that zygomatic bone. So that would be yellow if we were continuing that through. This is part of that sphenoid. Like it kind of shoots out up here. So this little part right here is part of the sphenoid. And then right here we have the temporal bone. Temporal, sphenoid. Here's the parietal on the sides. When we look in the middle, these are the nasal bones. And this bone right here, that is going to be our vomer. Here, I didn't actually draw it on this one, but if we look here right there, that's the mental foramen. When we look on the side right here, we have the external acoustic meatus. And so those are just some of the things. Now in lab, we're going to go through way more and you'll be using your textbook to help with those. But I just wanted to show you kind of the bones of the eye socket and some of the major parts that are commonly asked on various exams. Now let's get to the thoracic cage or the rib cage. And it consists of the bony thorax, which is the sternum, as well as the thoracic vertebrae, which you can kind of see below here. These are thoracic ones, and they're behind that. And then the ribs. Okay, so we have all these ribs. And those make up the rib cage or the thoracic cage. Now, ribs themselves are flat bones. And they don't directly attach to the sternum, but actually attach via costal cartilage. Now there are 12 pairs of ribs, which are flat bones. The first 7 pairs of ribs are called true ribs. So you see this here. So the first 7, so 1 through 7 are going to be true ribs. And then 8 through 10 are false ribs. Well, I guess 8 through 12 technically. 11 and 12 are what are known as floating ribs. So the true ribs are called this because they attach to the sternum by their own costal cartilage. One attaches via the first costal cartilage, 2 attaches via the second costal cartilage, and so forth. But then 8 through 10 are going to attach indirectly via a shared costal cartilage of rib 7's costal cartilage. 11 and 12 don't attach to the sternum at all, and that's why they're called floating ribs. So they only attach to the thoracic vertebrae, so T11 and T12. Ribs 3 through 9 are typical, meaning that they have the normal rib features. Atypical ribs are 1, 2, 10, and 12. So I already said 10 and 12 articulate only with one vertebrae. They don't attach to the sternum. So they are floating ribs. The first rib is not the same size as all the other ribs. It is a shorter, and it has a junction not with the full sternum, but actually a joint with the manubrium. And it also has a little tubercle on it for the scalenes to attach to, which is known as a scalene tubercle. Second rib is thinner than the other ribs, and it has a tuberosity known as serratus anterior tuberosity is found on the second rib. Scalene tubercle is found on the first rib. Besides that, there's not too much more you need to identify on the ribs except for what you'll see in lab. This is kind of the rules of articulation. So the superior facet number is equal to the rib number. So the superior facet of T5 is where the 5th rib attaches. The inferior demifacet of 5 is where the 6th rib attaches. So this is the little formula. So if I have so in here, we have the demifacet of T5, the superior demifacet of T5. So that's what's right here. This is that superior demifacet. It attaches to rib 5. The inferior one, which I have in yellow right here, attaches to rib 6. This is the 6th rib right here. So if it says what attaches to the superior demifacet of T7. So if this said what attaches to the superior demifacet of T7, the answer is the 7th rib. But if it asks the inferior facet of T7, the answer would be 7 plus 1 is the 8th rib. So a little kind of cheat sheet to figure out which demifacet goes with which rib. Now let's look a little bit at the sternum and the different kind of parts of the sternum. This portion right here is known as the manubrium. This is the body. And right here at the very tip is the xiphoid process. We have a few little parts that you kind of should know. This is the jugular notch. And right here on the edge is the clavicular notch, where the clavicle meets the manubrium. Right here, that's the sternal angle. And you can see all of these areas right here are where those costal cartilages join in onto the sternum. Finally, let's look at the vertebral column. It extends from the skull to the pelvis and protects the spinal cord. There are 5 regions that make up the vertebral column. So if we look right here at this image. So the first region is the cervical region. And there are 7 cervical vertebrae. The next region is the thoracic region. And there are 12 thoracic vertebrae that articulate with the 12 ribs. Next is the lumbar vertebrae. And there are 5 lumbar vertebrae. Then there is the sacrum. The sacrum contains 5 fused sacral vertebrae. So these are fused in adults. In children, they are not fused yet, but in adults, they are fused. And the last one is the coccyx. And the coccyx, or the coccygeal area, is 3 to 5. It depends on the person. There's 3 to 5 fused vertebrae that make up the coccyx, the tailbone. Now, there is a little way of remembering how many for the first 3, for all of the free vertebrae, and they are the meal times. So the cervical is going to be breakfast at 7 a.m. Thoracic is going to be lunch at noon, and the lumbar are going to be dinner at 5 p.m. So that's one way of remembering how many vertebrae are in the cervical, thoracic, and lumbar regions. Now the vertebrae are separated by pads, and you can kind of see that in the image here, these little pads right here. Those are known as the intervertebral discs. Intervertebral discs are sometimes abbreviated IVD. And there are 2 parts of the intervertebral discs. So if I was to kind of draw an intervertebral disc, it would look somewhat like this. That's a really tall one, but it has 2 parts. So the outside part is going to be this kind of dense, layered, fibrous material, and this is known as the annulus fibrosis. The center is a gelatinous part known as the nucleus pulposus. Now, we are going to get into a little bit more specifics of the different vertebrae in lab, but here are some of the basic components or basic parts that are found in almost all of our typical vertebrae. So these ones are the ones, this is typically what they have. So this main area right here, this is known as the body. So you can see that here, this is the body. When we look here in that anterior view, you kind of see these little horns you can think of up here. Those are going to be the superior articular processes. So those are the superior articular processes. Right below that, these are the TPs. Right, and on the TPs, we have a superior demifacet and an inferior demifacet, and if they're in the thoracic, so if we're in from T1 to T12, and those are going to be where those ribs articulate. So these are the TPs, transverse processes. Now the spinous process is this region right here. Whoops. Now the spinous process is this region right here. I'm just going to abbreviate SP, spinous process. And then below that is the inferior articular facets or processes. So this is where it's going to articulate with the vertebrae above. This is going to articulate with the vertebrae below. Right here, this little notch area is known as the inferior vertebral notch. When we look from the back, we see our TP again, transverse process. We see our inferior articular process, IAP, and we see our spinous process right there. The spinous process is that part when you go and kind of run your hand down the back of the spine that you feel. That's the spinous process that you're touching. That's on the posterior aspect, on the back, dorsal aspect. Running right down through the middle, if we're looking above, we can see that we have a canal. This is called the vertebral foramen. That is where our spinal cord goes through. And this is just an axial view. We're looking from top to bottom. And we see that we have a TP here. And then on the sides, we can see here's that inferior articular process. And here's our spinous process. So this would be posterior here. This would be anterior over here. And our discs would be found kind of right here and here. Or let's look at it from this side. Our discs would be here and here, and then our next vertebrae would come and it would attach here with that superior one attaching. So here we're looking at a few of the vertebrae just to get ourselves a little familiar with what they look like. So we have our cervicals, our thoracic, our lumbar, and then our sacrum. There are two atypical cervical vertebrae that you need to be aware of, that you are responsible for. The first one is C1, the second is C2. They have special names. So this is known as the atlas, and this is known as the axis. The reason this is known as the axis is because it has this thing called the dens. And that dens acts as a little pivot point for the atlas that goes kind of right, and they kind of go right into each other. So it's kind of the axis of where rotation, and that is where a majority of rotation of the cervical spine comes from, is right here at C1 and C2. So those are the two that kind of are unique. And there's different parts to it, and we'll look at all of those parts in lab. But I just wanted to show you what they each look like. You can see that those thoracic vertebrae attached to the ribs, so that's being shown here. And we see that fusion of the bones in the sacrum. That is it for our review of the axial skeleton. In lab, we're going to go into more depth on all this information, but that is just a kind of precursor general knowledge of this area. If you have any questions, please let me know. You can email me or you can come to lab, open lab on Thursdays from 5 to 8 p.m.
This video is for educational purposes only, and the information provided is not intended to diagnose, treat, cure, or prevent disease.